Energy systems. Slide 1. Use the first half of the PowerPoints and this audio clip to better understand the energy systems, and the second half of the PowerPoints and the assigned reading in Boyle's textbook to better understand injury reduction in strength training. Slide 2. The source of energy for the body is the production of ATP, which occurs from the energy released through the breakdown of foods. Carbohydrates are used in both aerobic and anaerobic activities, and fat is used only in aerobic activity. Slide 3. There are 3 systems that work together to provide consistent and needed ATP during exercise. Although we will discuss these systems individually, realize that all 3 consistently work together depending upon the needs of the body. The 3 systems are the phosphagen system, which is also known as the PC system or the phosphocreatine system. The second system is anaerobic glycolysis, which is also referred to as the LA system or the lactic acid system. The third system is referred to as the aerobic system. It's also known as the oxygen system or the mitochondrial respiration. In the following slides, I will include the facts, the sports that utilize the system, the ways to train it, and the ergogenic aid to enhance it. The first system is the ATP-PC, and slides 4 through 6 will discuss this system. Consider first the facts available on slide 4. This is the largest power source that is readily available because the ATP and PC are stored directly in the muscles, and it doesn't rely on a long series of chemical reactions to achieve power. It is also an anaerobic system, which means without the presence of oxygen, and it does not depend on transporting the oxygen we breathe to the working muscles. The sports that utilize this system are any that require quick, powerful movements that don't last for a long period of time. They are for short-term and high-intensity activities. This would include quick starts of sprinters as they come out of the block, football players coming off the line, high jumpers as they explode over the hurdles, and shot putters as they launch the implement. Now consider your sport. What movements require the ATP-PC system? Training this system. Phosphocreatine replenishes and becomes available again during recovery. This requires active rest on the part of the athlete, which would include lowering the heart rate by reducing the movement. Although it requires rest for replenishment, it will replenish within a few minutes, which means the athlete will be ready for another round of explosive movements. Interval training develops the efficiency of the ATP-PC system. A 1-to-4 ratio between work and rest is recommended. This would mean that for every minute of explosive all-out movement, the athlete would then be given 4 minutes of active rest to recover and replenish the PC system before the next round of high-intensity movements begin again. You could also manipulate the distance by having the athlete swim explosively across the pool or run explosively across the field, and then slowly swim the next 3 laps to recover, or simply jog the next 3 laps before the second round of interval training begins. The ergogenic aid for this system is creatine. We know that creatine is a substance made by the body and is used for energy. It is made up of 3 amino acids and combines with ADP, which remains when all of the energy source ATP is used up. Creatine will combine with ADP to make ATP available again. Because creatine is stored in the muscles, it is readily available to make up the ATP as needed. Regular balanced diets will provide the amount of creatine needed in the body, but for those who want to work out harder and more frequently, creatine supplements can be used to enable that. There are a lot of theories and guidelines regarding loading, cycling, and maintenance doses, but the general consensus is that creatine supplements should be used before intense exercise to enable the athlete to work out harder and longer. Side effects include weight gain, stomach pain, nausea, diarrhea, and muscle cramps. Slides 7 and 8. The second system is the anaerobic system, and the next two slides discuss the system. Consider the facts. ATP is developed through the breakdown of carbohydrates to glucose to lactic acid without the presence of oxygen. Lactic acid is the end result, which enables the body to get just a few more ATP. Oftentimes, lactic acid gets blamed for sore muscles, when really it is a naturally occurring part of anaerobic glycolysis. The sports that utilize this system are any that require exercise at high intensities for 1 to 3 minutes. Consider your sport. What movements require anaerobic glycolysis? Training the system. The anaerobic glycolysis system replenishes and becomes available again during recovery, just as the PC system. This requires active rest on a part of the athlete, which would include lowering the heart rate by reducing the movement. For example, having the athlete sprint a length and then walk 3 lengths. Interval training develops the efficiency of the anaerobic system, just as the ATP PC system. However, don't work the athlete at 100% effort and incorporate less rest between intervals. The general consensus is to aim for 70 to 85% of the athlete's maximum heart rate to be considered working in the anaerobic system. Some coaches rely on the puke index, feeling assured that they have worked the athlete anaerobically if he or she bends at the waist and empties the stomach following the activity. This isn't ideal, nor is it effective. The term anaerobic threshold is the focus when training this system. The goal is to increase the body's ability to tolerate the presence of lactic acid through training. This requires approximately 6 to 8 weeks of anaerobic workout for the body to adapt to the increased lactic acid. Physiologically, the blood and muscles increase the capability of neutralizing the acidity of the lactic acid, enabling the body to work out harder and longer without the presence of oxygen. The ergogenic aid for this system is baking soda. Baking soda is alkaline, which reduces the pH or acidity levels that occur in the blood from the lactic acid. Research demonstrates efficacy of using baking soda as a buffering aid. However, for some sports it is considered an illegal ergogenic aid. Also, the athlete can experience intense gastrointestinal distress from taking baking soda, including explosive diarrhea. Obviously, this would be very counterproductive to athletic participation. Slides 9 through 11. The third system is the aerobic system. Because the body is working out at lower levels, there is the presence of oxygen. This means that lactic acid does not develop. Only pyruvic acid, which passes through the mitochondria and enters a series of reactions called the Krebs cycle. The end result is oxidation and numerous ATP for energy. This is why an athlete who runs at a slow pace can run for many miles without undue fatigue. There is plenty of ATP being developed, whereas the athlete who is sprinting can only do for a short period of time because lactic acid is developed and there are less ATP available. The sports that utilize this system are long-distance runners and portions of athletic events that occur at lower to moderate intensity. Consider your sport. What movements require the aerobic system? To train the system, light to moderate intensity activities at 60 to 85% maximum heart rate will train the aerobic system. Depending upon the current fitness level and days of training, most aerobic adaptations resulting in an increase of VO2 max can be achieved in 6 to 12 months. VO2 max is the amount of oxygen an individual can use during activity. The goal is to raise the individual's VO2 max through aerobic activity. The muscles will say to the heart, if you deliver it, we will use it. So it's the heart's job to pump it efficiently and effectively. This is enhanced through training. Iron is an important part of the aerobic system because iron makes hemoglobin, which is the protein in the red blood cells that carries oxygens from the lungs to the rest of the body. If the athlete is iron deficient, he or she will have less carrying capacity and will experience energy loss and fatigue. There are 3 ergogenic aids used for enhancing the aerobic system. 2 are illegal and 1 is legal. EPO is a popular drug that is used to treat anemia from chronic kidney failure or cancer as it increases the red blood production in the blood. In healthy patients, this increase in red blood cells means there is more oxygen delivering capability, resulting in the ability to work out harder and longer. Blood doping works in a similar fashion, but instead of the drug EPO, the individual withdraws her or his own blood weeks before the event and then reinfuses it before competition to increase the oxygen carrying capacities. Caffeine consumption is considered legal in small doses as a means to release fatty acids in the blood. The body will use this first during aerobic activity and save or spare the available carbohydrates. Slide 12, till the end of this presentation, is information from the textbook readings this week. Please refer to the book, the PowerPoints, and the accompanied links for this section.